Daniel Kuning and currently live in Granville, Michigan. I was actually 47 years old, almost 48, I think, when I started to develop symptoms that I was aware of, but other people were more aware of because I'm a palliative care nurse practitioner. My main job was managing a group of other providers and doing inpatient consults and home visits. And I started forgetting about visiting patients. And I realized that I was missing a lot of things. First of all, my mood changed drastically. My problem-solving skills were gone. We had some problems at the house with a piece of furniture upstairs. My solution to that while my wife was gone was to get out the saw and cut the piece of furniture into pieces and throw it out the window. Moving forward to June of 2018, the neurologist called me and said, "I need to meet with you and your wife on Monday." And so we met with him, and he said, "You have mild cognitive impairment with moderate short-term memory loss and some long-term memory loss. You did not do well on your neurocognitive, and you're no longer safe to practice. You're done practicing today." This past September was my last visit I've had on a regular scheduled visit with Mayo, and they diagnosed me with Parkinsonism in addition to frontotemporal dementia.
It's incredibly hard. It's never ending and it's exhausting. Anyway, we had kind of divided roles that we operated together as a unit. And when all of a sudden his reasoning went awry, all of those responsibilities became mine. So my main goal is to try to keep Dan happy, keep our quality of life the best we can. And that doesn't always happen, and that's frustrating and it's exhausting.
Understanding the burdens that fall upon individuals who are caring for those who are losing the capacity to take care of themselves. Or in the case of Dan and Lisl, his memory issues, his functional issues, somebody has to be there to pick up the pieces and to help to guide him through those difficult days and the difficult moments in those days. And palliative care, I think, is uniquely positioned to be able to acknowledge the challenges that this places on caregivers and to make sure that our interactions with the caregivers lift them up.
Through sickness and health. We didn't choose this, but I still choose you.
I overnight went from a palliative care provider to a palliative care recipient because my diagnosis of frontotemporal dementia is life-limiting, multiple symptom management.
In the cases like Dan, the management of the disease is going to be challenging. However, we can certainly look at what is important and valuable in Dan's life, what is sacred to him, what are the most important things that he acknowledges in his life. And then how can we leverage that and make sure that everything that we do in terms of the medical care that he's receiving is both reflective and respective of that particular value.
And palliative care has kept me with bumpers up on both sides, going down the right road and taking my hand and leading me down the right road many, many times when I wanted to go on the other road.
I think the palliative care team also has done a really excellent job of helping Dan focus on a more realistic view of what is a good quality of life. Yes, Dan has had losses in his life as far as what activities he can and cannot do. Like he was passionate about hunting and fishing and things like that. And they come up with good recommendations of some other things that maybe would help with that. Those desires, but yet not be dangerous.
I used to have a two-wheel e-bike but I'm no longer steady enough for that. So I went to get a 3-wheel e-bike, which is awesome.
Good girl.
I mean, it allows me to go around the block as many times as I want and know my route and know I can come back.
And does it scare the pants off me? Yes, it does.
Yeah, she's scared to death of it. But I love it.
Hey, Bella.
I would say without palliative care, I would be on the wrong road.
The medical management of the symptoms and challenges that arise with this disease are very problematic, and so they are managing the symptoms in a very, very effective way.
Getting palliative care involved early helps so many different things.
So that this is not just simply, holding hands and being compassionate, but bringing a high level of medical care, a high level of supportive services. And that's what a team like Dan's palliative team is able to do for him.